Hello. So today I will explain about the problems with iron medicine and iron supplements. Iron medicines and supplements include heme iron and non-heme iron. Non-heme iron is the most commonly used iron supplement in the market and among the iron medicines. There are some heme iron supplements that can be bought over the counter, but actually they contain very little heme iron. Ingesting iron produces a lot of active oxygen in the body. Heme iron wrapped in a porphyrin ring, absorption rate is as high as 20 to 30%. Non-heme iron, other iron that is not heme iron, absorption rate up to 5%. So non-heme iron absorption rate is very small. Heme iron is easily absorbed by the body than non-heme iron. Supplements sold at drugstores and supermarkets, which are not so expensive, do not contain much of the necessary nutrition and often contain many additives. Commercially available supplements include advertising fees in the price of the product, so there are many expensive supplements that do not have much content. The quality of the supplement cannot be measured by the price of the supplement. When humans breathe, active oxygen is generated, but too much active oxygen causes rusting of the body. Active oxygen also have the effect of promoting the aging phenomenon and may cause various diseases such as cancer and arteriosclerosis. If you have a significant iron deficiency, you may need to take iron not only from your diet but also from medicines or supplements. Even if you are told by general tests that you are not anemic, you could still be iron deficient. Many menstruating women have iron deficiency due to menstrual bleeding. Some people say that they are taking iron-containing drinks or iron-containing foods because they are anemic. However, most processed products contain sugars, artificial sweeteners, and additives. The amount of iron contained in those products are very small and will have little effect on anemia and are harmful. So I don't recommend those kind of processed foods or supplements. There are several kinds of iron medicines. So if you have a Japanese insurance, you can use the insurance support. So the price is cheaper than supplements. And then organic iron or inorganic iron, and then there are several types: capsule or syrup or injection. But those kind of iron medicines have several problems. So one is active oxygen and iron content. So insurance prescription iron is non-heme iron. Excessive generation of active oxygen is a concern. We do not recommend over-the-counter iron supplements because they contain a very small amount of iron and many additives that are inferior. Heme iron supplements have a very small amount of iron, and the amount of heme iron is sometimes indicated by the weight of the raw materials rather than the amount of heme iron itself. And the side effects: nausea and changes in bowel movements, constipation or diarrhea occur. Maybe 22% patient feel these kind of side effects. And countermeasures for side effects: taking prescription iron medicines in the minimum necessary amount. It is also possible to adjust the amount of syrup to decrease side effects. So if you feel side effects, you can choose the syrup medicine, so you can adjust the amount easily. And the additives. So these are the examples. For examples, I show the capsule and syrup, and then this is the citrate medicine. And then so those medicines include many kinds of additives, and this medicine have coloring blue number 1, and this medicine also have coloring yellow number 5, and then so this include white sugar, and this include artificial sweetener. And I want to explain about intravenous injection of iron. If you take iron medicine orally, even if active oxygen is generated, the adverse effects on your body will not be so serious. However, if injected, excess iron will accumulate in the body, and great harm will be done. Therefore, avoid iron injections as much as possible. I have had only one case of a pregnant woman needing injections of iron because so at the birth, patient have bleeding, and sometimes it turned to be more than 1 liter. So patient have the massive bleeding, and if the patient is not anemic, she can avoid blood infusion. But if the patient have anemic, if the patient is anemic, so sometimes blood infusion is needed. So I choose injection for her. But if you don't have any emergency reason to cure anemia, I don't recommend to use injection of iron. And then so to increase the absorption effect of iron, taking iron with vitamin C, citric acid, and malic acid. So those kind of vitamin or acid, stearic acid or malic acid, will increase absorption. Supplements for medical institutions, I recommend those kind of supplements. So please, if you want to choose Heme Iron, please buy the medical institution's supplements. And then so I recommend this supplement, Floradix. You can buy this in website. And the problem of these kinds of supplements is the high cost of iron supplements. So if the iron deficiency is severe, it cannot be improved simply by diet. So you need to take supplements or medicines, but you need to care the cause why you are anemic, and then you need to cure the cause. So causes of iron deficiency and iron deficiency anemia are typically these kind of things. So bleeding due to excessive menstruation, lack of iron intake from food, absorption disorder, and the Helicobacter pylori is the bacteria. And then if the person have the infection of this bacteria, sometimes stomach atrophy occur, and then so have the disorder of digestion. So if you are anemic, it's better to check this bacteria. And these are the nutrition required to improve iron deficiency and iron deficiency anemia. Protein is very important to improve iron deficiency. So globin, the main body of hemoglobin, and transferrin, an iron carrier, are proteins. And vitamin B, there are many types of vitamin B, and it is important to balance the vitamin B group. And vitamin A, regulate cell differentiation and proliferation. So vitamin A is also important. And vitamin C increases mineral absorption. The lipid, cholesterol strengthens the red blood cell membrane. So not only iron, but also minerals such as zinc are important for improving anemia. I will give another lecture on the nutrition needed to get iron. So today I explained the problems of the iron medicine and the iron supplements. Thank you.